If your morning wood has vanished, it might not just be age. What if your body is trying to warn you about something deeper and you're ignoring it? Most men don't realize this. There's a specific 7-minute routine that may restore stronger erections without pills, injections, or awkward visits to the doctor. And the secret lies in a part of your body you probably haven't thought about since gym class. You were strong once. Energy came easy. Confidence was automatic. But over time, hesitation creeps in. You start noticing the changes: more downtime between erections, less sensitivity, poorer stamina. Maybe you've started wondering, is this just part of getting older? But what if I told you that your performance issues didn't start in the bedroom? They started in your hips. Ignore this, and the consequences reach far beyond just your sex life. Poor blood flow in the lower body can be an early warning sign. It's been linked to blocked arteries, heart issues, even hormonal slowdown. Studies from Harvard and the Mayo Clinic found a strong connection between erectile dysfunction and future risk of heart disease. It's not just in your head. Weak erections can be your body's early red flag. And even more concerning, low blood flow may lead to lower testosterone levels. That means more fatigue, more weight gain, and faster loss of muscle mass. Let's be clear, this is not just about pleasure. It's about confidence, hormone health, cardiovascular function, and possibly lifespan. But here's the part most men never hear. You don't need testosterone injections. You don't need to fill a prescription. And you definitely don't need to spend hundreds on supplements grown on some weird mountain in Asia. Because a group of men all in their 60s and 70s noticed dramatic changes in just a few weeks by doing one specific thing every morning. It's a 7-minute physical routine. Gentle, targeted, easy to learn, but powerful enough to help bring back the kind of erections you haven't had in years. And the reason it works is because it targets the one muscle group that's controlling more than you think. Most men ignore this area their entire lives. But once you understand how to activate and strengthen it, everything changes. So stick with me, because in a moment, I'll show you exactly what it takes and how you can start tomorrow. Now, first let's talk about the real root of this problem. Most men believe erections are just about hormones. But really, they're all about blood flow. Think of it this way: you can have all the testosterone in the world, but if blood can't get where it needs to go, raw desire doesn't mean much. Now here's where things get interesting. Your pelvic floor is a group of muscles under the surface in your hips and groin. These muscles are crucial for pushing blood downwards. They also support your bladder and your core. But more importantly, they're what trigger and sustain erections. When those muscles get weak, guess what suffers? You have control, strength, and sensitivity. Now add to that inactivity. The average man over 60 spends more than 10 hours a day sitting, driving, watching TV, on the computer. That's over a third of your day compressing arteries in the hips and groin, blocking blood flow. And on top of that, stiffness starts to build in the hips and thighs. Even your breathing shifts, becoming shallow and tight. All of this makes your lower body less responsive. Think of your blood vessels like a garden hose. If your hip muscles tighten and pull, that hose gets pinched. Water can't flow through, no matter how much you turn up the pressure. Same with your circulation. Poor mobility equals compressed blood pathways. Now here's a quick test. Try this tomorrow morning. Stand in front of your mirror. No shirt. Look at your posture. Are your shoulders rounded? Is your belly tilted forward? Do your hips slump? That posture is telling you a story. It's saying there's no urgency here, no readiness. Your nervous system sees that slouch and shuts off blood flow to the pelvic area because it thinks you're at rest, not at play, definitely not ready for intimacy. And confidence? That starts with how your body holds itself even before your mind catches up. Let's look at a real-life example. John, age 67, retired firefighter, played competitive sports most of his life. But over time, things started slowing down. He said, "My confidence was quietly fading. I didn't feel like myself." He didn't want pills. He didn't want dependency. So he talked to a physical therapist who recommended a daily pelvic activation routine. Just 7 minutes a day. Week 1, nothing major. But by week 3, he started waking up with morning erections again. By week 5, he felt stronger in the gym, more presence in the bedroom, And in his words, like a 40-year-old with some wisdom, he wasn't alone. A study in BJU International showed that pelvic floor exercises were over 40% more effective than general lifestyle tips for men with ED. And in a veterans clinic not long ago, a group of retired servicemen tried a similar 10-minute mobility sequence. Results? More energy, better blood flow, and most surprisingly, they reported stronger emotional reconnection with their spouses. Because this isn't just about function, it's about identity. You show up differently when you feel strong and connected in your own body. And it all starts down low in the pelvic muscles, core mobility, and blood flow pathways that get ignored for decades. Bottom line, this isn't your fault. The modern world teaches men to sit, slouch, and forget their core muscles exist. But the good news? You can undo it. Not with surgery, not with medication, with a simple 7-minute daily routine. A set of focused movements that stretch, activate, and train the muscles responsible for blood flow, posture, and performance. Coming up, I'll walk you through the exact step-by-step of that routine. Each move, how to do it, and why it's quietly transforming men's health behind closed doors. Here's what that 7-minute routine actually looks like. And don't worry, no complex stretches, no yoga mats, and definitely no spandex. This routine is designed for regular guys. Guys over 50. Guys who haven't stretched since Carter was president. If that's you, you're in the right place. The first move? It's called the hip tilt. It sounds simple, but it may be the single most important movement to reconnect your core to your pelvis. You just lay back on a firm surface. Bend your knees, feet flat. Then, slowly tip your pelvis toward your belly button, holding for about 5 seconds. Then release. What does that do? It activates the deep pelvic muscles gently. It also resets your lower back, opens your hips, and starts teaching your brain how to control that area again. Some physical therapists call this the switch because once you get this area firing, everything else starts turning on. Now the second move is the seated squeeze. You sit upright on the edge of a firm chair. Then, imagine you're trying to stop yourself from going to the bathroom midstream. That small squeeze? That's your pelvic floor engaging. Hold it for 5 seconds, then release. Do 10 rounds. Most guys are surprised at how weak these muscles feel at first. That's normal. It's just like going back to the gym after 20 years. Some muscles forgot how to fire. But with a little focus each morning, they come back surprisingly fast. Now for the third move, standing hip openers. Stand tall, one hand on a wall for balance. Slowly swing one knee up, then rotate it out, like you're opening a gate, then lower it and switch sides. This opens the hip joint, improves flexibility, and helps decompress the blood vessels in your groin. Remember that garden hose analogy? Open hips mean fewer kinks, more flow. Now, before we continue, let me pause and ask you this. When was the last time you just stood quietly, focused on your breath, and noticed your lower body? Most men are completely disconnected from their hips and pelvis. It's almost like this area is invisible. But once you bring your attention there, things change. Even your posture begins to shift. That's why the fourth move matters. We call it the glute bridge. Back on your back, knees bent. But this time, press your heels into the floor and raise your hips up toward the ceiling. Squeeze your glutes at the top, then lower slowly. This strengthens your backside, crucial for pelvic support, lower back health, and circulation. A therapist I spoke to called the glutes the forgotten power source for men over 60. She said even guys who could lift heavy weights would often fail this movement because the right muscles had shut down. Reactivating them can quickly improve lower body strength and blood flow. Now the final part of the routine is about breath. Too many men breathe up in their chest. Shallow, tense, always in stress mode. But when you breathe through your diaphragm, meaning you feel your belly rise and fall, it tells your nervous system to relax. This kind of breathing can increase oxygen, improve circulation, and lower anxiety all at once. So here's the drill. Sit upright in a chair. Close your eyes. Breathe in through your nose for 4 seconds. Feel your belly expand. Hold for 2. Then exhale slowly through your mouth. Do that for 1 minute. That's your finish line. So let's review. Hip tilts for control. seated squeezes for pelvic activation, standing openers for mobility, glute bridges for power, diaphragmatic breathing for blood flow and calm. Altogether, it takes just around 7 minutes. You can do it first thing in the morning, right after you brush your teeth, even while waiting for coffee to brew. And here's the key: consistency beats intensity. You don't need to sweat buckets or feel like a Navy SEAL. You just need to keep showing up. Every day. That's what John did. That's what those servicemen in the clinic did. And that's what's quietly changing men's health behind closed doors without a single pill. But now you might be wondering, will this really work for me? You won't know unless you try. But one thing I've seen over and over: men who commit to this for just 21 days often see changes that surprise even their doctors. One man in our group, Bill, age 72, sent an email last month saying, "I didn't expect much, honestly, but now I'm back to waking up feeling like I used to at 30. My wife even joked I'm walking taller and more smug." That confidence? It doesn't come from ego. It comes from knowing your body still remembers. It's not too late. You're not broken. You've just been frozen in place for a while. But now you've got a map. In our next video, I'll show you one way to make this routine even more powerful by adding one unexpected tool that's already in your kitchen. And no, it's not a supplement. But before that, here's what to do next. Step 1, bookmark this video. Step 2, tomorrow morning, try just the first 2 movements, hip tilts and seated squeezes. Even just that small start can wake up your pelvic floor. Then tell me in the comments, how did it feel? Tired? Weak? Surprising? I want to hear about it. Because odds are once you feel that muscle switch flip back on, you won't want to go back. And trust me, your body will thank you. Now get ready. In the next video, I'll reveal the one kitchen tool that may boost blood flow, testosterone, and energy even further when combined with this 7-minute routine. You won't want to miss it.